Hospital-grade receptacles are specifically required in patient care areas and critical care areas within healthcare facilities. This requirement is outlined in NFPA 99, the Healthcare Facilities Code. Patient care areas encompass locations where patients receive medical treatment or monitoring, including patient bed locations. Critical care areas are those areas within a healthcare facility where patients receive intensive medical care and monitoring, such as intensive care units. Beyond patient care and critical care areas, hospital-grade receptacles are also mandated in specific locations based on potential risks. Receptacles installed within 6 feet, or 1.83 meters, of sinks or other water sources must be listed as water-resistant. This requirement aims to mitigate the risk of electrical shock in areas where water exposure is likely. Furthermore, receptacles located in damp or wet locations must be listed for such use. This ensures that the receptacles are designed and constructed to withstand the environmental conditions and minimize the risk of electrical hazards. To summarize, firstly, hospital-grade receptacles are required in patient care areas, including patient bed locations. Secondly, hospital-grade receptacles are required in critical care areas. Thirdly, water-resistant receptacles are required within 6 feet or 1.83 meters of sinks or other water sources. Fourthly, receptacles in damp or wet locations must be listed for such use. The National Fire Protection Association, or NFPA 99 Healthcare Facilities Code Section 9.2.1.10 states receptacles in patient care areas shall be listed as hospital grade. NFPA 99 Section 9.2.1.10 states receptacles in critical care areas shall be listed as hospital grade. NFPA 99 Section 9.2.1.10 states receptacles within 6 feet or 1.83 meters of sinks or other water sources shall be listed as water resistant. And NFPA 99 Section 9.2.1.10 states receptacles in damp locations or wet locations shall be listed for such use. It is important to note that the specific requirements for hospital-grade receptacles can vary depending on the applicable electrical codes and standards in the specific jurisdiction. It is always recommended to consult with a qualified electrical professional to ensure compliance with all relevant regulations. In healthcare facilities, electrical safety is of paramount importance. Hospital-grade receptacles play a crucial role in minimizing the risk of electrical shock to patients, staff, and visitors. These receptacles are designed and manufactured to meet stringent performance standards, ensuring reliable electrical connections and enhanced safety features. Hospital-grade receptacles undergo rigorous testing to verify their durability, grounding reliability, and resistance to leakage current. They are typically constructed with heavier gauge contacts, a more robust grounding system, and a reinforced housing to withstand the demands of a healthcare environment. Water-resistant receptacles are specifically designed to prevent water from entering the receptacle and causing electrical hazards. They incorporate features such as sealed housings, gaskets, and watertight connections to protect against moisture ingress. Receptacles listed for damp or wet locations are constructed with materials and designs that can withstand exposure to moisture without compromising their electrical integrity. These receptacles are typically made from corrosion-resistant materials and incorporate features to prevent water from accumulating inside the receptacle. The use of hospital-grade receptacles, water-resistant receptacles, and receptacles listed for damp or wet locations is essential for maintaining a safe electrical environment in healthcare facilities. By adhering to the requirements of NFPA 99 and other applicable codes and standards, healthcare facilities can minimize the risk of electrical hazards and ensure the well-being of patients, staff, and visitors. The selection of appropriate receptacles for healthcare facilities should be based on a comprehensive risk assessment that considers the specific environmental conditions and potential hazards in each area. Factors to consider include the proximity to water sources, the likelihood of exposure to moisture, and the potential for physical damage to the receptacles. The installation of hospital-grade receptacles, water-resistant receptacles, and receptacles listed for damp or wet locations should be performed by qualified electrical professionals who are familiar with the applicable codes and standards. Proper installation techniques are essential to ensure that the receptacles function as intended and provide the necessary level of electrical safety. Regular inspection and maintenance of receptacles are also important for maintaining a safe electrical environment in healthcare facilities. Receptacles should be inspected for signs of damage, such as cracks, loose connections, or corrosion. Damaged receptacles should be replaced immediately to prevent electrical hazards. In addition to the requirements for receptacles, healthcare facilities must also comply with other electrical safety standards, such as those related to grounding, wiring, and overcurrent protection. A comprehensive electrical safety program is essential for ensuring the safety of patients, staff, and visitors. In conclusion, hospital-grade receptacles are required in patient care areas and critical care areas, while water-resistant receptacles are required near water sources, and listed receptacles are required in damp or wet locations. Adherence to these requirements is crucial for maintaining a safe electrical environment in healthcare facilities. By following the guidelines of NFPA 99 and other applicable codes and standards, healthcare facilities can minimize the risk of electrical hazards and protect the well-being of patients, staff, and visitors.